Good morning. So today we're going to do a live demo of BioTE testosterone pellets. So we have our setup here, and something that's really interesting that I'm going to show you is if you can see what's in here, that is the actual pellet. So you can see it is a very, very small, looks like a grain of rice, and that pellet is what's going to give her about 100 of testosterone, and that's going to be a slow release, and it lasts about 3 to 4 months in women, and at a much higher dose, of course, for men as well. So what we're going to do first is we're going to take some time and clean her up, and I'm going to really clean and prep the area that we're going to be using. And testosterone pellets are great because what it does for women is it gives you energy, vitality, libido, sex drive, muscle mass, memory, cognitive skills, mental clarity, lots of drive and motivation. These are some of the same things that it does for men. Now, it's one of those things that you could, yes, good. So what we're going to do is we're going to place a little lidocaine in the area, a little stick, my dear. And we're going to just feel a little whelp here, burning, and she's doing great. And then we're going to just go ahead and put the lidocaine all the way in where the pellets are going to go. And she's probably just feeling a tiny bit of fluid going in, maybe a little burn. She's doing great. And once that starts working, how are you doing?
I'm doing good.
Good, awesome. And then we're going to put this down. Give it a little second for it to work. So usually if you're menopausal, you get two types of pellets, estradiol as well as testosterone. Today we're going to do just the testosterone because she's not due for her estradiol yet, because that happens every 6 months. It actually lasts for 6 months. So what we're going to do now is we're going to place a small incision. How you doing?
Good.
Good. So she's not feeling that much. And just a tiny incision. That's going to be all she needs, and she didn't feel that at all because of the lidocaine. I'm going to now take what we call a trocar and going to insert it gently. And that does not hurt. All she might feel is a little pressure. How are you feeling?
Fine.
Good. So all we're doing is just gently inserting it through the tiny incision that we've made, and you just kind of rotate it in, and she's not feeling that at all.
No.
And once we get it to where we want it, because we want the pellet to sit right around here, what I do then is I take out back part of it, put it down, get my pellet. Again, this is what it looks like. Tiny grain of rice is what it looks like. And we placed it very carefully right there. Slide it in, put it down, get the plunger right here, and we put it in. And it's dislodged. And then all we do is this slides back out, and she's done. It's over. Everything is in, and she'll be good to go for at least 3 to 4 months with the testosterone. We're going to check her levels in about 6 weeks. She doesn't need any stitches. These are steri strips, all she needs. See, no bleeding right now. We're going to place the steri strip right here, and the instructions for this are going to be that she won't get into a tub or and immersed in water. She can take showers, but she won't do any of that for about 72 hours. And she will have a dressing on top of this, which is easy. This will come off in about 24 hours, but it's going to hold a little pressure right there. So that's all she really needs. She's going to remove the dressing. Thank you, ma'am. In 24 hours, leave the steri strips on. So this is a pressure dressing, and I'm going to apply a little pressure this way. How are you doing?
I'm doing good.
Good. So she's doing great, hasn't flinched at all. doing well. We're going to get her redressed. That will be off the screen, and that's it. So pellets are wonderful because the great things about especially the BioTE pellets are we dose according to what the patient needs. So we are very customized and precise by doing lab work. So with postmenopausal women, we're looking at their FSH, estradiol, testosterone, progesterone level, and all of the rest of things that we do, the CBC, CMP, vitamin D, everything, to really dose it the way that the individual needs it. At 6 weeks, we check the levels, and then if we need to do a little booster at that time, we can do that. I always suggest start low instead of starting high because you can always add, you cannot remove. Even in premenopausal women, we have women in their 30s, 40s, same with men, 30s, 40s, etc. Just doing the testosterone pellets has been life-changing for people because it gives them that assertiveness and that energy and that drive and motivation and libido, muscle mass, all of that, that really they were lacking in the past. So thank you for joining me.